We saw Nathan Fowler present kind of data, or got the so-called R-squared regimen in phase 3 clinical trials, completed enrollment, awaiting the results of that. And of course, the R-squared CHOP regimen being looked at. But again, your group's been looking at the potential role of lenalidomide in the ABC setting of diffuse large B-cell lymphoma, with a potential role for action with Ibrutinib, right?
Right. So actually, this is a very interesting paradigm, because in this case, lenalidomide affects the BCR signaling cascade at a lower level than Ibrutinib does. And in the laboratory and in xenograft models, the combination of the two against tumors of the activated B-cell genotype, in fact, they were highly synergistic. And so what we've been doing is combining them with conventional chemotherapy, where they're given along with the chemotherapy for a limited number of cycles, as you would give any chemotherapy. This is in relapsed refractory ABC, with the idea being that if we can really modulate the survival cascade that terminates in the case of ABC with NF-kappa B, that we can possibly sensitize these tumors so much to the effects of genotoxic stress, which you get from conventional chemotherapy, that maybe we can change the natural history of relapsed refractory ABC large cell. And if in fact we see a signal there, then I think it would just be a matter of time before you moved it into untreated folks. And it may even be possible, if they modulated sensitivity so greatly and increase cure rates so much, that you may be able to then reduce the number of cycles of chemotherapy that's combined with this, maybe even theoretically to a single cycle. So I think that we need to be doing these stepwise. Adding lenalidomide and Ibrutinib to chemotherapy does add some increased toxicity, but we've been very careful to only give it for a limited period of time around the period of the chemotherapy, to really leverage its synergy and not to buy some more longer-term toxicity that could occur by continuing it throughout the entire chemotherapy cycle.